Hello, everyone. I'm happy to welcome you to our weekly webinars. My name is Nadia, and I will be a presenter today. So today we're happy to welcome our speaker today. This is the special webinar dedicated to our head doctor, Galina Strelko. She will be happy to answer all of your questions.
Hello, nice to see you.
Yeah, let me introduce a little bit our topic today. Yeah, so as I mentioned, this is the online meeting with the head doctor of IVMED Fertility Centre, Dr. Galina Strelko. Yeah, here there is opportunity to learn more about our lead fertility specialist. So our Dr. Galina is a PhD, obstetrician gynecologist, fertility specialist, doctor of the highest category. She's also a member of ESHRE, ASRM, UARM, and the head doctor and co-founder of medical center IVMED. And here you have a chance to see her personally. So today we have a set of questions that has been forwarded to us via email by our different patients. So these are real cases of people, of our clients who are interested in the answers to their problems. So let's start with this first question. I'm 43 years old. My AMH level is 0.9. I want to try my tripronuclear transfer. Does it make sense? Or it's better to use donor eggs? So please, could you tell us what you think?
Good question. Thank you very much first for your kind presentation. And now I will try to answer to this interesting and quite typical question. We should mention that age of women, it is a very important factor of success of IVF treatment. After 38, 39, 40 years old, around 70–80% of all eggs and embryos has genetic problem. And they can stop their development during cultivation. They can not be very good quality. They can have abnormal genetic when we will do the genetic test of this embryo. So 43 years old, okay, it may be sometime very good ovarian reserve and good egg quality, maybe just opposite. So I cannot answer exactly in this case because we don't know the quality of eggs. But in most of case, 43 years old, the main problem is the quality of eggs and then not good quality of embryo due to not good quality of egg. Unfortunately, we cannot correct the quality of eggs with stimulation or with some additional treatment. The pronuclear transfer, this is the technique which permit to take fertilized nucleus of egg from own egg and put inside of donor cytoplasm, because there are a lot of works which explain that amount of mitochondria and quality of mitochondria inside of cytoplasm can influence the possibility of egg and embryo to have good development. But in 43 years old, main problem rise not cytoplasm, but unfortunately nuclear problem, abnormal genetics. So if it is like that, pronuclear transfer will not change a lot the probability of pregnancy. From the other hand, we don't know exactly before we try. Sometimes some patients, even who are more young, like 35 years old or 30 years old even, may have good fertilization, but then arrest of development of embryo at 48 or 72 hours. And in this case, quite often it is cytoplasmic factors which can influence. So we don't know before we try. There is no possibility to do investigation before. In this case, we can see that anti-Müllerian hormone is not very high, but not very low as well. So we can expect to receive maybe 7, maybe 8 egg, maybe 6. It is good number for 43 years old, but quality we don't know. So we can try and we can see if the quality of embryo will be better with pronuclear transfer. We can think that, okay, some kind of cytoplasmic factors can influence and can improve the probability of pregnancy. But in most of cases, in this situation, maybe we will not change a lot with this technique. I hope I answered this question.
Thank you very much for your explicit answer. And I also wanted to remind you that there is an opportunity to use our chat to write your own questions to the doctor, and we will answer them at the end of our presentation. So the next question that we have is, if I have a low AMH, 0.7, do you recommend mild stimulation with low amount of medicine?
Thank you very much. Very good and very interesting question. If we have low IMH, first thing that we should know that if you have measured only once your IMH, it is not very exact, because depends on laboratory, depends of diagnostic system, depends of machine with which was done this test. So maybe in some laboratory you will have not 0.7 but 1.2 or something like that. So necessary to see also the antral follicles count. If your antral follicles count is very low, like 1, 2, maybe 3, it is really like that. We recommend in most of cases mild stimulation, because with mild stimulation or with normal stimulation, we will have the equal amount of follicles. But if we will see with antral follicle count that you have around 10 or maybe 7 follicles, in this case, better to do the standard stimulation, and we will have for sure much more eggs, because for one egg which we receive during the egg collection, the expected probability of pregnancy rate is around 4, maybe 6%. So much eggs we will receive, more chance we will have to achieve pregnancy.
Mm-hmm. Thank you very much for a helpful answer. Let's take a look at the next question. Okay, it's a pretty long one. I had kidney transplant last year. My doctor says that it will be hard for me to carry a baby. I want to do my own stimulation and transfer an embryo to a surrogate mother. I'm taking anti-rejection drugs. Can it affect the stimulation or the quality of the oocytes?
Very good question. Thank you very much. Time to time, we have patients with kidney transplant. I cannot say that it is very big amount of patients, but maybe 15, 20 we have done yet. Case like that. And in most of case, there is two potential problems. One problem that this transplant may not work excellent. It means that kidney function may be decreased. And in this case, the risk of ovarian stimulation may be quite high, especially if woman has good ovary, good response, and risk of ovarian hyperstimulation syndrome. Because during ovarian hyperstimulation syndrome, kidney work very hard. It is very, how to say, dangerous to have heavy hyperstimulation with this general condition. So if we have very young women with very good ovary and kidney transplant, necessary to do mild stimulation to not receive the situation with ovarian hyperstimulation syndrome. And second point, that necessary to be careful with infections, because these anti-reject drugs can decrease immunity, and during egg collection, for example, we have more risk of infection, so necessary to give antibiotics to protect patient from these infections. Otherwise, nothing special need to do this kind of treatment. Normally, if kidney function is good, we can do our stimulation. If decrease, we should see case by case if it is safe to do stimulation or not.
Mm-hmm. Thank you for your explanation. The next question is, I have high TSH 3.24, and I want to do ovarian stimulation. Can I do that? Or firstly, I need to decrease the level of the hormone.
Okay, good question. We have quite often, we see quite often the problem with thyroid gland in our patients. And okay, 3.2, it is not very high. The level which we expected to have if women would like to carry pregnancy, better to not exceed 2.4 TSH level. But for stimulation, 3.2, it is okay. It is not very high, because formally the high level depend on laboratory. It is 4.2, 4.6 sometime in some laboratory. So this level, mentioned level, is not very high. But for pregnancy, better to have no more than 2.4, because there are a lot of publication about subclinical hypothyroidism. We can call this condition subclinical hypothyroidism. Subclinical, it means that there is no big clinical symptoms, but we have in deficit of thyroid hormone in this level. So if we have this subclinical hypothyroidism, it may influence negatively the IQ of future baby, decrease IQ. In some publication, they mention that 10 point less than in women with normal TSH. So it is quite important to have normal level of thyroid hormones during the pregnancy. If TSH is very high, not like that, but for example 8, 9, we can see not good response to stimulation, because simultaneously quite often we have high prolactin level as well, because these two hormones is looking quite similar for organisms. So for normal stimulation, better to have also more or less normal level.
Mm-hmm. Mm-hmm. Thank you very much. I'm sure this was good information to think about for our patients. The next question is, does HCV infection affect fertility? Are there higher risks of miscarriages? Can I do IVF if I have this infection?
Oh, thank you very much for this very difficult question, because it depends. You know, there is different forms of HCV infection, and it may be minimal activity, maybe high activity. This infection can exist during previous 15 years, and some problem with liver can be at the moment of IVF treatment, or may occur like 6 months ago. So necessary to see the exact stage of infection and exact form of infection. In some forms of this infection and with minimal activity and not decreased liver function, we can provide IVF treatment, but we cannot transfer this embryo to surrogate mother, for example. The probability that baby will be infected during the pregnancy is very low, and it is quite low. It depends on PCR of concentration of virus inside in blood. Yeah, less virus we have, less probability we have to be infected. HCV infection, it is in comparing with hepatitis B, this is less virulent infection than hepatitis B. So it is quite safe for patient, but necessary to see the exact situation and exact stage and type of infection and influence to liver functions.
Thank you very much. Let's go to our next question. Is about NK cells. I have NK cells. I had failed IVF attempts with my own egg cells. Now I want to try egg donation. Do you have any special treatment for NK cells? What can I do to prevent failed implantation?
Look, there are a lot of publication about NK cells in the literature. It was maybe 10-15 years ago. It was very important, considered as very important factor. After was written that not influence a lot, and now there is new works which show that it may influence. So generally NK cells participate inside of uterus in implantation processes, because fetus, it is also always genetically not equal to genetic of woman. So immune system should recognize this embryo and should permit to him to implant. And these NK cells participate in process of implantation. So if your immunity very aggressive, it is not permit to embryo to implant. If immunity is very, how to say, permit to implant to all eggs, will be quite often miscarriages. So important to know this situation if we have repeated implantation failure, if we have a lot of miscarriages in anamnesis in previous attempts. And in our clinic, if we made diagnostic of increased activity of NK cells, we can use human immunoglobulins injections, or in some cases we can use the intralipid injections. The both working well, so we will see if simultaneously we have another immunologic problem. Okay, maybe we will use rising immunoglobulins. If we have only NK cells, in most of cases we will use intralipid treatment. So maybe like that.
Thank you very much. Our next question is, I have problem with cervical canal and a lot of doctors refuse to do the transfer for me. I've heard about transmyometrial embryo transfer. Do you perform that?
Good question. Thank you very much. It is quite exotic technique. We not use it very often. And I know that a lot of producer of this specific catheter for transmyometrial transfer not producing them yet, but some of them promise that will produce next year new modification. So it is difficult to find specific device to do that, and not often it is really need. But we have some experience, successful experience with patients who has some problem with cervical channel, or for example some synechia or some anatomic abnormality. And according to the literature, the probability to become pregnant after this technique is a little bit less than normal transfer, but our experience says that we have mostly the same results as with normal standard transfer. Only one problem that necessary to know a little bit before that we will do in this kind of transfer, because necessary to order this specific device, which they help specific catheter. It is like needle and catheter inside, and we can do this technique successfully.
Thank you. Sounds very promising for some patients. I have a systemic lupus erythematosus. I'm 29. My MH level is 3.54. I take medicines from SLE every day. and my kidneys results are creatinine 194, blood urea nitrogen 10.2, protein total is 54. Can I try ovarian stimulation? Do I need to stop taking medicines during the stimulation?
Okay, situation is not easy in this question. You can see a lot of problem. Systemic lupus erythematosus may give the problem with kidney and may also give problem with heart because it may influence the joint tissues. So necessary to see if heart working well, so do some cardiography, echocardiography, etc., some investigation. We can see that kidney also work not so well, but in this case, okay, we can try because situation is not critical. As well as in case with kidney transplantation, we should take in consideration the amount of follicles in ovary, and stimulation should not be very aggressive. It should be mild stimulation to receive like 7, 8, 10 eggs no more, because otherwise increase the risk of hyperstimulation and also increase the risk for kidney function. Anyway, we will try to do the protocol with trigger of final egg maturation with agonists of gonadotropin releasing hormone. And this technique permit us to avoid maybe 99% of all cases of ovarian hyperstimulation. So if we will use mild stimulation and trigger of agonists, I think we can do the stimulation quite safe. And if we will do as well the previous general investigation of health, of heart, of all functions, general blood analysis, etc.
Thank you very much. And this is the end of our initial questions that were pre-sent to us, but I can see that we have several more questions in our chat. Okay. So let's try that. I had 5 failed IVF attempts. I'm 37. IMH level is 1.1. Last time I had 5 embryos and transferred 2 on the 3rd day, but I didn't succeed. What do you recommend? One more try or surrogacy?
5 IVF attempts, it is quite a lot. The official, how to say, we can say that there is a problem of implantation if there was 3 embryo transfer with good quality of embryos without success. So we can say that in this case, of course, we have a problem of implantation. Of course, necessary to see which kind of additional examination were made. For example, some tests of endometrium may be helpful, some genetic tests may be helpful, sometimes immunological investigation can be quite helpful. So necessary to see what exactly were done for these patients, which kind of additional examination, and what is the result of this examination. Because in some case, if we can see some exact problem during this examination, for example, ERA test demonstrate that window of implantation is not on 5th, 6th day, but on 9th day. We can change the day of transfer. Yeah, if we found that woman has or man has some genetic abnormality like translocation, like deletion of chromosomes, we can discuss the pre-implantation genetic diagnostic of this embryo and try to choose embryo with balanced genetic, and maybe will be more successful the transfer of this kind of embryo. In some situation, we can find chronic endometritis. It is the chronic inflammation inside of uterus. And if we have this condition, implantation will not occur or will be abnormal and after will be miscarriage. So the treatment of chronic endometritis sometimes give very promising results. So necessary to see the additional tests. If all tests, possible tests were done and try different techniques and nothing happened, okay, we can discuss surrogacy, but it is in most of cases the last option.
Thank you very much. And we have one more question. I'm 39 years old. I had 3 failed IUI and 2 IVF tries, but I didn't get any 5-day embryos. I used donor sperm. Is egg donation my only chance? Maybe I should try PRP, or are there any other additional technologies that can help?
Okay, also good question, because if in this case donor sperm were used, it means that maybe there is no male factor of infertility. It should be theoretically normal, good quality of spermatozoid, of concentration, of morphology, of motility. So probably the main problem is egg quality. Patient write that she has 39 years old. Okay, it is not 45, but from the other hand, not 35. So the quality of eggs in this age may be decreased. In most of cases, we can see the dramatically decrease of quality due to age after 42, 43 years old, 44, for example. At 39, in most of cases, we can receive good quality eggs. Okay, it is individual, but maybe in this case, we can try the pronuclear transfer because age is quite promising. And if we can receive as minimum 4 or 5 eggs during retrieval, we can enough zygote to make this technique. And maybe in this case, we will find some cytoplasmic factor which will be overcome with this pronuclear transfer technique. PRP technique, okay, we can do that, but it is mostly to increase the number of eggs. The idea of PRP technique is take blood from own blood, choose specific cells which have biological activity, and then inject them inside of ovary, and it may improve the blood circulation, some growth factor inside of ovary, and in 2-3 months we can see a little bit more follicles, and we will be able to receive a little bit more eggs. But it is not influence a lot the quality of eggs. Quality will be more or less the same. Quantity may be improved.
Thank you very much. It's all the questions that we had for today. Thank you very much for your participation, Dr. Galina. I'm sure that your answers were very reassuring and very informative for our participants. So it will be all for today, but make sure that you join us for our next weekly webinar. We have a lot of other interesting things to talk about. So thank you
very much.
Yeah, thank you.
Be healthy.
Yeah, stay healthy.
Yeah, stay healthy. Bye-bye.
Goodbye.